I am Dr. Renee Critchlow, and I am a founder of The Ladder. We started The Ladder because we felt a need. One of the questions, as family physicians, we seek people of all ages. We'd ask kids what they want to be when they grow up, and so many kids were like, oh, I want to be a doctor, I want to be a nurse. And then, we at Broadway Family Medicine, the faculty there teach at the medical school. And when I looked around, I didn't see a lot of kids from North Minneapolis. So we started The Ladder with the idea that we'd get young kids exposure to the healthcare careers.
I'm Christopher Allen, and I'm a future inspiring physician. I've been in The Ladder since 2008, 2010. Usually it involves hands-on approaches with a lot of the specialties you see out there, like gastroenterology, like the one that I'm going for, cardiology, internal medicine, sports medicine, that type of thing. Say for like cardiology, you're like looking up like labs and how to diagnose people and treat people. Say like you're on a football field and you go down. One of the exercises that we did was that we would put the person on a stretcher like we were actually taking someone from the field to the sideline. So it was very authentic.
There are a lot of Black and brown students who are interested in going to medical school. In 2019, there were a little over 4,000 Black students, just Black students, who had graduated from college, finished their medical school application, and applied to the medical school. There were about 1,300 that were accepted. And they said one of the biggest issues is test scores. Everyone keeps saying, well, we won't even look at an application that has under 510 on their MCAT. This is the issue. In medical school, they're concerned about who's going to pass step one. And so a lot of the times, if you don't have high enough MCAT scores, they won't even interview you.
My name is Dominique Erland. I am a third-year MD PhD student at the University of Minnesota, and I'm actually starting my first year in the epidemiology PhD program, and I study malaria epidemiology. I first knew I wanted to be involved in medicine and research at a very young age, probably in middle school. Shortly after my mom had been diagnosed with breast cancer and was receiving treatment and received surgery. And I got to help her with her bandages and support her and cook for her. And I just love being able to help somebody. The work that I do, especially with the Ladder mentorship program, is important because I am a Black woman who is in medical school.
My name is Lonzel Ramsey Jr. I am a community physician, but as far as the Ladder is concerned, I am the vice chair for the board for the Ladder for America. My journey to medicine came through a couple different states. I was born in Nebraska, I went to school in DC. People had free clinics and things like that, but nothing like the Ladder, nothing to be able to help reach back and bring somebody else with you. It has kept me motivated, whether it's medicine or any career. There's times where it can get you tired and beat you down, but when we go and we see kids that are excited to learn and excited to grow and excited to be hopefully doctors and nurses and pharmacists and veterinarians, it enriches your soul.
With all these things, we need organization. We're past the point of this being an all volunteer organization. We need to be able to hire at least one staff. What we want to do is be able to spread chapters around the country, but we don't want people to have to reinvent the wheel. We'd like to have a website that is the nexus, that is the support system for anyone who's interested in starting a Ladder.
We designed the Ladder to have opportunities for healthcare, but healthcare is not just doctors and lawyers. Healthcare is dentists, healthcare is nurses, healthcare is pharmacists, healthcare is veterinarians. And we have kids that want to be all those.
We need people to invest in the Ladder the way the Ladder invested in you. So what do we need? We need us to remember, lift as we climb, build as we grow. And if you remember the pledge, that's even better.